You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. Hello, my friend. Welcome back to the show. If you're new here, so happy you found me. I'm Dr. Dana Gibbs, a thyroid and hormone specialist, and I am going to talk to you guys today some more about hypothyroidism and weight loss. So if you're new here, I am so happy you found me. I am happy to be back in the groove of recording because, as you may have noticed, I went several weeks without a single new episode over the fall and around the holidays. Emergencies happen and my mom's health crisis is ongoing. So hopefully things are stable enough now that I'll have time to continue putting out content here for you. So last week was the TLDR version of weight loss and hypothyroidism. So this week I'm going to explore more details about the multi-hormone interaction theory of weight gain. And before we get into it, if you're listening to the podcast, there is a new feature. If you check out the episode show notes, there is a link where you can ask me questions or send me messages that I can answer in following episodes. I also, of course, very much appreciate 5-star reviews. It is super easy and it helps more people who need me find the content. Oh, if you're here on YouTube, happy to have you. I would love a like and a subscribe to my channel so you'll get all my content as it comes out. All right, get out your hip waders because it's going to get deep. So to better understand how hypothyroidism makes it so much harder to control your weight, I need to take a couple of steps back. First of all, as I have discussed on previous episodes of the podcast, there are 3 ways that hypothyroidism shows up for people. Number 1 is the one that you're all used to. That's a severely underactive thyroid where there is insufficient production of thyroid hormones, T3 and T4, that are measured by measuring the TSH and maybe the T4, where the TSH shows up as high. This occurs because of damage that has been done to the thyroid gland and it's not able to keep up. This is the type of hypothyroidism that's most understood by most doctors, and it responds generally pretty well to the standard treatment of levothyroxine. Unfortunately, the way most people are given levothyroxine frequently causes some problems. It causes ways 2 and 3, although that's not the only reasons why people would get these next 2 issues. So reason number 2 to have hypothyroidism is if you have inefficient activation of inactive thyroid hormone T4 to active hormone T3. This tends to happen because of stress or illness or a bunch of other reasons in your body where your body thinks that it needs to slow down your metabolism. Now, the third way this happens is by the production of reverse T3, which is a hormone that actually blocks the action of the active T3 thyroid hormone. And way number 2 and way number 3 tend to coexist and can occur even in somebody who has reason number 1 as well, who's on levothyroxine. So having enough thyroid hormone does play a crucial role in activating and regulating your metabolism, basically the process of converting the food we eat to energy. But as we learned last week, that's not the only factor, and it's not the most important. So let's talk about some myths that have persisted about weight loss and dieting, because much of what we were taught about how to lose weight is wrong. So we've all heard, and even some doctors still believe, that eat less and move more is the main answer or the only answer to weight loss. But because you're listening by now, you've probably figured out that this really just doesn't work, even though the weight loss industry would just like you to think that one more fad diet or meal shake or workout program is going to be the answer. But the truth is that just 25 days of calorie restricted eating lowers your basal metabolic rate or your metabolism. That's what we talked about last time. And the stricter you are and the more you restrict the calories and the faster you lose the weight initially, the more your metabolism will slow down to conserve the calories that you do eat. So, more myths. Low fat is the way to go. Low fat is healthy. Well, unfortunately, if you're eating less fat and trying to lose weight, you're eating a higher percentage of carbohydrates in your diet. And in fact, eating more fat tends to be protective. The foods are more satisfying, they slow your digestion down, they reduce your hunger better than low-fat foods. You can also burn fat for energy without raising your insulin level, which is great, especially when you're trying to get used to burning fat, where you're getting yourself into being a fat burner versus a sugar burner. So eating less carbohydrates tends to help with weight loss for reasons that we're going to get into in a minute. So next myth is that more intense cardio burns more calories. Well, in fact, it actually burns more sugar and less fat. And more recently, people have said you can't outrun a bad diet no matter how much you exercise. And that may not be totally true, but exercise is important in ways besides cardio and not the way most people think of it. The last myth I want to talk about is the fact that eating several small meals and snacks throughout the day is the way to be healthy. And no, absolutely not. This is not the way we evolved and is a recipe for becoming an exclusive sugar burner and packing on pounds. This is also true for children. And so frequent snacks, in my opinion, is a way to have your kids not want to eat at mealtime. All right, so that's enough of the myths. So we're going to go into some hormones now that are at least as important to pay attention to as thyroid, and maybe more important. As a matter of fact, I know they're more important. So we talked in some detail last time about insulin resistance and what that means for your health. Now, I realize that you, the listener, may be untreated, undertreated, or improperly balanced in your regards to your thyroid. And maybe you don't even know for sure if you have hypothyroidism or not because you've been told that you don't. However, this idea that if you can just get switched to the right thyroid medication or the right combination of thyroid hormones or take enough thyroid hormone, then the excess pounds will just magically come off. That is incorrect because there's usually way more going on that has to do with the other hormone problems that coexist with hypothyroidism. So the next major hormone I want to talk about is leptin and the problem of leptin resistance. So here's the thing. If you have obesity already and you have high leptin, then you automatically have leptin resistance. If you are 20 to 30 pounds or more overweight and you get a blood serum leptin level and it's greater than 10, then you have leptin resistance on top of your insulin resistance. Well, okay, what is leptin? Well, leptin is the satiety hormone. Leptin is the hormone that's supposed to go to your brain and tell you, hey, I'm full, we can stop eating now. Leptin resistance is a condition that affects the signaling between your fat cells and your brain, and it has been associated with a bunch of different health conditions, such as higher risk of infections, autoimmune diseases, malnutrition, inflammation, and most notably, leptin resistance is a major biological contributor to obesity. So here's how this works. People with obesity have many fat cells, And because the fat cells produce leptin in proportion to their size, people with obesity have very high levels of leptin. Normally, these high levels of leptin signal to your brain that enough energy is stored and it's time to stop eating. However, in leptin resistance, the brain is less sensitive to or fails to recognize that signal. And researchers have suggested that there may be 4 different factors that cause this. The brain might have fewer leptin receptors in response to high leptin levels. The leptin receptors might not be working properly. It's possible that less leptin is able to cross the blood-brain barrier, or that there's a gene mutation in the leptin itself or in the leptin receptor. So, despite high leptin levels being present in the body, which should be signaling you've got enough, don't eat anymore, the brain may not be reacting to that correctly. So, when your brain doesn't receive the leptin signal, it senses that your body is starving, even though you have stored enough energy or more than enough energy. So this can make your brain change your behavior to regain body fat, such as by eating more or reducing your energy output and reducing your energy levels to make you burn fewer calories at rest. So several possible mechanisms behind leptin resistance have been identified. First of all is inflammation. So inflammatory signaling in the part of your brain called the hypothalamus is likely a really important cause of leptin resistance in both animals and humans. So anything we can do to reduce inflammation is a helpful thing. Having elevated free fatty acids in your bloodstream may increase fat metabolites in your brain and interfere with leptin signaling. This is a problem because you want to burn fat, you have to break it down and release those fatty acids into your bloodstream before you can burn it. Having high leptin in the first place may impact the ability of leptin to cross your blood-brain barrier and give the signal. Now, most of these factors are amplified by obesity, and the worse it gets, the worse it gets. So you can get trapped in a vicious cycle of gaining weight and becoming more leptin resistant over time. And leptin resistance may be one reason why most diets fail to promote long-term weight loss. So if you're leptin resistant, losing weight still reduces your fat mass, which leads to a drop in your leptin level. So that's good, but your brain may not necessarily reverse the leptin resistance right away. When leptin goes down, you're going to then experience possibly hunger, increased appetite, reduced motivation to exercise, a lower number of calories burned at rest. That's your basal metabolic rate. And your brain gets the signal that you're starving and initiates a process to regain the lost body fat. This is really the reason for yo-yo dieting, because then when you lose weight only to gain it back and then some shortly thereafter, because your leptin levels go down, but the leptin resistance is still there. So what can you do? Sounds hopeless, right? Well, a review of the science in the last few years confirms several things that are helpful. Avoiding processed food like the plague. Eating processed foods drives inflammation and increases leptin levels and leptin resistance both. Eat soluble fiber. A review in 2021 found that eating soluble fiber helps lower leptin levels in people with obesity over the long term. Then exercise. So there was a report in 2023 suggesting that high intensity burst episodes of exercise help reverse leptin resistance. They also note that exercise stabilizes leptin levels and hunger. So a 2021 review shows that short sleep duration increases leptin in your body and can increase leptin resistance in your body as well. The authors noted that this can lead to other health conditions such as diabetes as well. Lowering your triglycerides. A 2017 study showed that having high triglycerides prevents the transport of leptin from your blood to your brain. So the best way to lower triglycerides is to reduce your starchy carb and sugar intake. Now, triglycerides, you would think, well, that's a kind of fat, right? So you want to lower your fat. No, the best way to lower triglycerides is to lower starchy carb and sugar intake. I'll say it one more time. The final one is to eat protein. A 2021 review of some animal studies show that low protein diets increase leptin levels and leptin resistance. However, the authors note that more human studies are really needed to measure protein's effect on human leptin resistance. So, is there a leptin reduction diet? Yes, actually. And surprisingly, or maybe not surprisingly, there's very little difference in this and the insulin lowering diet and measures that I talked about last time. So, the first step is to eat foods that supply 20 to 30 grams of protein for your breakfast without sweets. The second one is don't eat after dinner, identical to what I talked about last time. Make sure not to eat anything for at least 3 hours before you go to bed. Eat a maximum of 3 meals a day with no snacking in between, allowing for 5 to 6 hours to pass between each meal. Some people say 4 hours, but 5 to 6 hours seems really reasonable to me as well. Reduce your starchy carb intake, but don't completely eliminate carbs. There are plenty of carbs that are high fiber carbs that are good for leptin resistance and helpful. The next one is to practice portion control at each meal. If you keep eating until you're stuffed, try putting a smaller amount of food on your plate in the first place and stop for 10 minutes or so to see if you're really full before you go back for seconds. To follow this diet, you may need to learn about the macro content in the foods that you eat, but you really won't need to obsessively count calories. This diet also places a strong emphasis on eating fresh, organic foods and avoiding chemical additives like sweeteners, natural flavors, and any ingredient that you can't pronounce its name. The need for protein and fiber is also really stressed. It's recommended that each meal, not your day, but each meal, contain between 400 and 600 calories in the general ratio, 40% protein, 30% fat, 30% carbs. This leptin diet allows you to eat a wide range of vegetables, some fruit, and protein sources, including fish, meat, chicken, turkey. Fresh fruit in small quantities rather than sugar-dense desserts is a suggested dessert option if you really feel the need. When I was talking about insulin last time, I didn't mention that fruit has enough sugar to really raise your insulin levels. So it's important to, one, eat your fruit after you eat your protein, also to eat it in limited quantities and not at every meal. You can also eat nut butters in moderation, eggs, and full-fat cottage cheese as long as there is no sugar added. The next thing is that protein-dense grains and legumes such as quinoa, steel-cut oatmeal, lentils are really good choices. And because your somewhat lower carbohydrate intake can lead to gut changes or constipation, you really need to make sure you're choosing high fiber foods as often as possible. Now, probiotics. There is a particular probiotic that I now recommend that contains live cultures of the anaerobic bacteria Akkermansia, Akkermansia. There is only one company in the U.S. that currently sells true live cultures of either pure Akkermansia or a blend of Akkermansia and other beneficial cultures and prebiotic fiber. This combination acts kind of as a natural GLP-1 and has documented in controlled studies to reduce blood sugar, reduce diabetes, reduce insulin. And that set of probiotics is missing in the microbiome of diabetics. So adding that back if you have obesity is a really good idea. Finally, when you're on that leptin diet, you do want to avoid all sweeteners, including the non-calorie sweeteners, regular sodas, diet sodas, and energy drinks of any kind. You're also encouraged to eliminate soy products, except for fermented soy. So, while leptin is more important in terms of its influence on your metabolism, another factor that has its origins in leptin is that it makes thyroid signaling worse as you lose weight. This is problem 2 that we talked about in the first part of the episode. So falling levels of leptin as you reduce your calorie intake and reduce the amount of fat that you have will generally reduce your natural production of thyroid hormones by allowing your TSH production to fall. The result of this is that you can have normal TSH while your thyroid hormone is barely adequate or even low. So people come in to me, sure, their thyroid is not functioning properly with many hypothyroid symptoms, but the problem is frequently not with the thyroid gland itself or with its output. It's that loss of signaling that's the problem. This is why I focus more on free hormone levels and the balance of total T3 to reverse T3 when I prescribe thyroid hormones for people. And I don't depend on the TSH to tell me whether your thyroid function is adequate. So, lab test wise, if your leptin level is greater than 10 to 12, that's abnormal, even if it's technically in the reference range that's listed by the lab. So I've talked about it before that reference ranges are an average of all the people that have the lab tests that seem to be normal. But when 70% of us are overweight or obese, that average is going to be skewed pretty bad to the too high side. And finally, the symptoms of leptin resistance are inability to lose weight no matter what you do, constant weight gain even if you're only eating 1,200 calories a day. Okay, that's not normal. It's an indication that your metabolism is really damaged. Constant food cravings and constant fatigue and slow metabolism. Now, while I don't prescribe these, this is where GLP-1 agonist can be helpful to get you started, because part of how they work is by lowering the amount of free leptin in the serum and helping you control your cravings when you're in the maintenance phase of weight loss. So the next hormone that's equally as important as leptin is insulin resistance, and I introduced that concept in the last session. So I would ask you, when was the last time you had your fasting blood insulin checked? Maybe never. But this very simple test can be really helpful in determining your insulin resistance status. And once again, the reference range is misleading because the sample population contains such a high percentage of us who are insulin resistant, even if we're not overweight. So a fasting insulin level of 5 or lower is normal. Higher than that indicates that your liver is manufacturing glucose overnight and that your body is needing elevated levels of insulin to help dispose of it. So remember, insulin resistance means it takes more, sometimes twice as much insulin, to uptake and use the same amount of glucose in your muscle cells. And genetically, you have between a 50 and 70% chance of having insulin resistance, and low thyroid signaling just increases that. Okay, why is that a problem? Lots of reasons. Insulin is a growth hormone. Nobody wants their fat cells to get bigger, but that's actually exactly what insulin does. It can also grow tumors, including cancer cells. It can grow blood vessel plaques and promote fatty liver. It also allows, if you're pregnant, allows a fetus to grow too big, causing potentially birth problems and predisposing those infants once they're born to also have insulin resistance. Insulin resistance also allows tissues in your body to age quicker. This is due to the blood glucose levels being higher than they would be without the insulin resistance, both at an average level and when they spike up after meals. So glucose when it's high, can bind to and damage other molecules in our bodies. And we actually measure this. It's called glycosylation, and it means binding with glucose. And it's irreversible, and it happens to various molecules, including nucleotides, and those are the building blocks of our DNA. For example, your skin will look older more rapidly if you have insulin resistance. Degenerative arthritis will accelerate as well. And patients who come in, for example, with chronic knee pain or back pain can be triggered by insulin resistance, and reversing the high insulin levels by changing what and when you're eating, like we talked about last time, can reverse much of this pain. We also routinely measure glycosylated hemoglobin. Hemoglobin is a molecule in our red blood cells that carries oxygen. Glycosylation actually reduces the oxygen delivery by the hemoglobin, so that the higher your hemoglobin A1C, the less oxygen can be delivered to your body cells. And the A1C test measures that glycosylated hemoglobin. It's an approximation of your average serum glucose level over the past 90 days, approximately. So high insulin levels affect other hormones in your body. So high insulin will, in a menstruating woman, generally cause virilization, meaning characteristics of men, including polycystic ovarian syndrome, acne, and mood changes due to elevations in a neurosteroid called 5-alpha reductase. This gives relatively low testosterone, but high dihydrotestosterone, which is the active version of testosterone. It interferes with the woman's libido and her mood, which further worsens depression, anxiety, and PMS. It also causes anovulatory cycles, so not enough progesterone, which also affects your mood. So that's also a vicious cycle. Lipolysis, that's breaking down fat so it can be used for energy, only occurs in a tight, low range of blood insulin levels. So frequent snacks and high-carb meals don't allow insulin levels to fall. So now compare that to fasting or eating larger meals less frequently, which means you spend more time in that lipolysis zone. So a fasting insulin greater than 5 generally suggests you have insulin resistance. Fasting insulin blood test ought to be taken in the morning by around 9 a.m. Fasting glucose levels are also, of course, important. So a fasting glucose level around 85 is considered good. If you're already a pre-diabetic, it will take work and time to get your fasting blood sugar down that low, because your liver is conditioned to manufacture glucose by breaking down proteins early in the morning, even if it goes low overnight. So I recommend that you have those two tests, the fasting insulin and the fasting glucose, done with every time you get a routine lab test, in addition to the hemoglobin A1C. So if you're looking at hemoglobin A1C by itself, there's two problems. The first, once again, is the published normal range. So published normal range says that anything below 5.7 is described as normal, even though 5.7 correlates with an average blood sugar of 117. Yikes, we just said 85 was good. Yeah, that's right. Mainstream medicine mostly considers A1C normal right up to the point where it becomes diabetes, prediabetes. And of course, that cutoff and the one for full-blown diabetes at 6.5% are arbitrarily chosen by some committee. In my world, the one where we're trying to fix obesity and prevent diabetes by controlling insulin resistance, an ideal hemoglobin A1C is 5 or less. And 5 correlates with an average blood sugar of 97. So the second issue with relying on hemoglobin A1C is that it's an average. It doesn't tell you how high or how long your blood sugar is spiking after you eat a meal. And it certainly isn't telling you how much insulin you're secreting daily or how high your insulin spikes are. That said, if you're steadily losing weight, fat mass hopefully more than muscle, then by definition, you're keeping your insulin under control. Remember, fat doesn't break down when insulin is high. So if you're doing all the things and still having trouble losing, a blood glucose monitor is a decent proxy for insulin levels. So these can be the more traditional finger stick monitors where you check yourself a couple times a day before and after a meal, or it can be one of the newer continuous glucose monitors. So these devices are really amazing because they give you real-time data about what raises your blood sugar or lowers it. Not just food, but your activity level, your alcohol, your sleep quality, etc. So I have a whole course that I do once or twice a year that's centered around getting maximum value out of these amazing devices. So since last year, these are even available over the counter. But my personal favorite is still the Freestyle Libre device, which does need a prescription from your doctor. These are still the cheapest. And even if you don't have insurance, you can get this. And it's about $2 a day to use it. You're going to be giving up your Starbucks anyway, and so you can afford it. The other two lab tests I pay attention to in regards to insulin resistance are fairly common, cheap, and easy to add to a standard lab set if they're not already included. One of them is uric acid. Uric acid is produced in your body when insulin resistance is present during the breakdown of blood sugar because it's a breakdown product of something called lactate. Now, uric acid should be around 5 or less. The next test is a fasting lipid panel, and triglycerides above 100 are an indicator of too much carb and sugar intake. And if you get this number down below 100, or even ideally down to where it's about at a 1-to-1 with your HDL cholesterol, then you are doing great. So HDL is good cholesterol, and it's better when it's higher. All that said, having hypothyroidism, if it's not ideally treated, makes it really hard to lose weight for several reasons. In summary, it lowers your basal metabolic rate. People with hypothyroidism tend to have a lower BMR, meaning fewer calories are burned at rest just to maintain your basic body functions like breathing, circulation, and cell repair. And even with the same food intake and activity level, more weight gain or difficulty losing weight occurs when your basal metabolic rate is lower. It can also cause fatigue and exercise intolerance. It makes it harder to stay physically active because you're just tired all the time. And lack of exercise, of course, further decreases calorie burn and doesn't help you build muscle, which also contributes to weight challenges. Hypothyroidism can cause fluid retention. This is another one. It leads to a feeling of bloating and weight gain, which is actually unrelated to fat and can account for up to 10% of the excess body weight experienced by people with low thyroid. Then muscle mass. I already said it a little bit, but sufficient thyroid hormone is crucial for building new muscle mass. Without enough thyroid hormone, you can't use protein to develop lean muscle. And the more lean muscle you have, the more you can burn calories and boost your metabolism. And most of my patients do respond better to a combination of T3 and T4 hormone replacement, as T4 alone may not convert efficiently to active hormone T3. So one final thing I want to talk about, in integrative medicine, we use a combination of approaches to help optimize our patient's plan for weight loss. The first one is personalized nutrition. You focus on anti-inflammatory foods that support thyroid health, such as increasing intake of vegetables, lean proteins, healthy fats, and fiber. Particularly the eating plans that I've discussed in the last 2 episodes are the recommended ones. The timing of the food intake is nearly as important as what you eat, and avoiding processed foods and excess sugar, which can lead to insulin resistance and worsen weight gain, are super important. Then the next part of the integrative approach is addressing nutrient deficiencies. So many hypothyroid patients are deficient in key nutrients like B vitamins and minerals like iodine, selenium, zinc, and magnesium. These are so critical for optimal thyroid function and body function in general. So supplementation of these, when it's appropriate, can help support thyroid and metabolism. All right, hormone balance. It's not just about thyroid hormones. Balancing your other hormones like cortisol and insulin and your sex hormones is really essential for effective weight management in most people. Physical activity. You want to start slow, especially if you're really fatigued, but consistent exercise is key for maintaining muscle mass and supporting metabolism. Particularly, I am fond of progressive overload resistance training, or otherwise known as weightlifting. This is particularly recommended because muscle tissue burns more calories than fat, even at rest. And speaking of rest, recovery days are as important as exercise. And again, sufficient and balanced thyroid hormone is necessary for building new muscle, which is critical for boosting your metabolic rate. Then stress management. This is also a part of integrative medicine because high stress exacerbates hypothyroidism and leads to more weight gain. Some of the techniques that we use include mindfulness, meditation, and other stress relief techniques, and support weight loss by reducing cortisol levels. This includes making sure that you're getting adequate, high-quality sleep. Then patience and persistence, because weight loss with hypothyroidism is often slower, but it's important to be patient and persistent because rapid weight loss results in the leptin resistance problems that we talked about at the beginning of this episode. So small, sustainable changes in diet, lifestyle, and thyroid management will add up and yield better long-term results than extreme measures. And then support systems. I encourage people to seek support, whether it's through healthcare providers, patient groups, or online communities. Those can really make a significant difference in managing weight and overall well-being. So, to sum it up, weight loss with hypothyroidism is certainly possible, but it also requires a different approach than what works for people without thyroid issues. By understanding how hypothyroidism affects metabolism, balancing your thyroid hormones, and addressing lifestyle factors like diet and stress, you can make progress towards your weight goals. So thanks for tuning in today. If you found this episode helpful, be sure to like and subscribe or leave me a 5-star review. And if you know someone who could benefit from this, please share it with them. Until next time, I'm Dr. Dana Gibbs. Have a great day. Thank you for listening to this episode of Beyond the Thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion, and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.